All right, Dr. Evans, one of the topics that came up multiple times was, can you explain what went on with the pause on the Johnson & Johnson vaccine? What the adverse effect that the concern was about it, and then just kind of give us a run through on why it's available and some background.
Sure. So the Johnson & Johnson vaccine was the third vaccine to make it to the market. It's a different vehicle than the previous vaccines, the Moderna and the Pfizer vaccine. It uses an adenovirus platform. And I think a couple positive things about this were it lets us know that the surveillance system that's in place is working, because they noticed an uptick in some unusual reactions, and they decided it needed closer scrutiny. So they paused the delivery of the Johnson & Johnson vaccine. It had been over 6 million doses given, but they noticed a small uptick in a rare condition called sinus thrombosis, which is a blood clotting disorder accompanied by low platelets that seem to be exclusively in young women between 18 and 50. And there were 6 cases originally identified, and I think a few more on the fence. But the same condition, unfortunately, can occur with COVID itself. COVID is a prothrombotic situation where you can get more blood clots, and this is possible with COVID as well. In fact, you're more likely to get it through the COVID virus than you are through the Johnson & Johnson vaccine. That being said, I think they did due diligence to be sure that this wasn't a deeper problem or other problems. And I think it's important that if you're considering the Johnson & Johnson vaccine or any of the vaccines, you discuss it with a provider to see what your risks are. Certainly young women and women who have a family history of blood clots or are on estrogen therapy for any reason should pause to think. It's still a very low risk, but that's a good discussion to have with your provider. It's back being distributed again, and it seems to be going well. The risks are, again, low, close to less than 1 in a million for the general population. It's very popular with the college campuses because it's a one and done vaccine. So a lot of the college campuses are getting the Johnson & Johnson vaccine. They're also doing workplaces with it, which is very convenient for shift workers and people that maybe can't come back at the same time to get the second dose. So I think it's been reviewed and evaluated. I think it also goes back to people's concerns that these vaccines were rushed and that they weren't vetted like other vaccines were, but that is not the case. All of these vaccines have been vetted and have been scrutinized for adverse side effects. They had to pass all of the same criteria to be released. They just were able to do it in a faster fashion because the government subsidized the manufacturer's ability to do this, and they didn't have to wait in between to get approval. They were able to go on to the next step. So these vaccines have been incredibly well studied, and nothing is safe. Certainly not getting the vaccine and getting the virus is not safe. And but I think it's a good. One of my children just got the Johnson & Johnson vaccine here last week. So I think it's reasonable, but if you are female between 18 and 50, you have blood clotting or are on estrogen, I think it's a good discussion to have with your physician or provider.
And correct me if I'm wrong, but one of the big reasons for the pause was also to educate us as healthcare providers, because not all blood thinners are the same. And as you mentioned at the beginning, this is not just a blood clotting disorder, but a low platelet disorder. And it was to educate us to make sure if we diagnose it, that we use the right treatment.
Correct. So heparin is usually used for blood clotting disorders, but in this case, heparin actually makes it worse. And so some of the, there was one death, I believe, from this, and some significant cases, but now that they're not using heparin in these cases, the results are far more favorable. So yes, it was a good opportunity to learn more about it.
So the most recent published literature as of this past week was, now that it's being recognized better, it's such a rare disorder that many of us may go a career without seeing it. But and now that we know how to treat it correctly or more correctly, the vast majority of people are having a complete recovery, and not just a partial, but a complete recovery from the initial insult.
correct.